We are here today with Medix healthcare consultant, Dr. Scarlet Spain. Hi, Dr. Spain.
Hi, Andy. How are you?
I'm doing well. How about you?
I'm good. Nice to see you again.
Yes, nice to see you. We've been talking with Dr. Spain about a lot of issues as they relate to healthcare in the last year, particularly around COVID-19. And as there have been a lot of updates in recent days around the COVID-19 pandemic, vaccines, and how folks should be approaching the pandemic as it continues on, we wanted to check back in with Dr. Spain to see, what were the latest updates from the CDC and other healthcare sources, and what people could be doing to remain safe. And there's another reason why we're talking to you right now, because it is National Immunization Awareness Month, which I'll be honest, I was not aware of until very recently. So I was wondering, before we start digging into the details of the pandemic, if you could share just a little bit about what goes into this month of awareness.
Sure. Thanks for having me. So, National Immunization Awareness Month is held in August, and this has been a time that's been designated for highlighting the importance of vaccination for people of all ages. So, the CDC website houses a lot of great information and resources that can be used to assist healthcare providers, patients, parents, just anybody with questions about vaccinations and requirements and timing and that kind of stuff. So it is important to remember that although August is our time to highlight this, immunizations are imperative all year long.
Yeah, that's a great point, and certainly something that has been driven home in the last year in a big way. Because I
Absolutely.
know, obviously, vaccinations have been top of mind as we're talking about the COVID-19 pandemic, but obviously, it applies much more widely than just COVID. Of course, that when I think of the healthcare space, number one thing I've been thinking about has been the latest developments around COVID-19. So, can you give us sort of an overview of where we are right now in regards to the pandemic?
Well, or I, speaking for myself, really had started to see and feel some optimism at the beginning of the summer. But the Delta variant, which we've been hearing a lot of buzz about lately, is now making up a predominant number of our cases. And this is frankly very concerning for multiple reasons. So we see some areas in the US where there are a disproportionate number of unvaccinated people. And obviously, our kiddos are falling into this group as well, as we don't have a vaccine approved for children under age 12 in the US currently. The Delta variant does seem to have the potential to be impacting younger age groups more than the previous variants we had seen. And we are seeing a rise in cases, hospitalizations, and deaths with statistics from the CDC stating that cases are on the rise in nearly 90% of US jurisdictions. We are also seeing outbreaks specifically in areas of the country that have low vaccination coverage as well. As of late July, 35% of US counties are experiencing high levels of community transmission. This could be catastrophic for areas with lower vaccination rates.
Wow, yeah, that's definitely concerning. I know we're all seeing these updates on the news, and it could sort of be confusing and alarming at the same time. So I'm hoping you can break down some of the things that you brought up in that overview there. And number one being the Delta variant, because that is certainly leading the way in all the stories I've been seeing lately. So could you give me a little bit more information just about what is the Delta variant?
Sure. So it's a highly contagious SARS-CoV-2 virus strain, which was first identified in December in India. So we were seeing on the news all the issues with India and how COVID was so severe over there. So this is that same strain. It's also impacted Great Britain strongly and has been here in the US. Our first case was March that we found it. So the World Health Organization says that we are at a very dangerous period of the pandemic due to the Delta variant becoming the predominant strain. So this Delta variant is dangerous and spreading quickly.
So it seems like, like you said, this is a variation of COVID-19. So what really causes viruses like this to change or mutate in this way?
Yeah, that's a great question. So all viruses evolve over time and undergo changes as they spread and replicate. So going from person to person, variants happen as the virus is transmitted. So oftentimes the changes or mutations will make the viruses less infectious. Sometimes though, unfortunately, these changes during replication may make a mutation that will allow the virus to bind to an individual better. So this is where the concern comes in. So this variant that we're seeing with Delta now has essentially increased the fitness of the virus and allows for better binding or invasion of the immune system.
Okay, so with all that in mind, how is the Delta variant different than what we were seeing previously with COVID?
Yeah, so the CDC director stated the Delta virus is more aggressive and more transmissible than the
Mhm.
strain we saw at the beginning of the pandemic. And it's also spreading quickly. So the Delta variant represents more than 83% of the virus spreading in the United States currently, as of like today or this past week. It is one of the most infectious respiratory viruses we know of. And Delta is more contagious than the other virus strains that we've seen previously, as mentioned. So the CDC estimates that 20% of cases in the US were due to the Delta variant toward the end of June. And by the end of July, Delta was the cause for more than 80% of new US COVID-19 cases. So
Wow.
the R naught, and if you have watched any of our videos before, we've talked about this, but the R naught of Delta is estimated to be 3.5 to 4, as opposed to the original coronavirus strain that was approximately 2. So as a reminder, the term R naught, it's a mathematical term that describes how many additional cases of a disease each infected person will cause during their infectious period. So how many people will get sick from one person, basically. So these numbers represent a range and will vary depending on a variety of factors that may change from situation to situation.
Mhm.
And we're also seeing that Delta variant behaves differently from these past strains. So those who are vaccinated with previous versions of the virus carried less of the virus, essentially making them less likely to spread infection. With the Delta variant, research and data that we currently have is showing that both vaccinated and unvaccinated people have the same amount of virus in them to transfer infection. With that being said, I definitely want to make it known that vaccines are working and they do greatly help to prevent serious infection, hospitalizations, and death. Vaccinated individuals still represent a very, very small amount of people who are transmitting the virus.
Okay, yeah, I think that is a great point to keep in mind too, because obviously there's so much concerns of people thinking, I was vaccinated, but now I'm spreading this, so not quite sure how to approach it. But that is a great thing to keep in mind, that hospitalizations, so serious infections, death are all being curbed by the vaccines, and that's at least somewhat comforting, especially as we keep hearing this term thrown around, which I hadn't heard before, called breakthrough infections.
Mhm.
So I'm wondering if you can share a little bit with me about that. Like, what is a breakthrough infection, and should I be thinking about that? How concerned should we be? I was wondering if you could just give a little background on that as well.
Absolutely. So with breakthrough infections, although they're exceedingly rare,
Hmm.
basically it means that a infection can occur in even those who are fully vaccinated. So breakthrough cases happen in a person who's been fully vaccinated that still gets COVID, so they'd still test positive. So with that, they can transmit the virus with the new Delta variants. So we're seeing this more. This does not mean the vaccine is failing. You will see breakthrough cases when there are large numbers of people infected circulating throughout the community.
Okay, with all of that in mind, breakthrough cases and everything, how is this Delta variant being impacted by the vaccine?
Yeah, so research is showing that mRNA vaccines do provide protection against hospitalizations and severe illness with the Delta variant. So vaccination remains extremely important. So best solution is to prevent transmission. We will keep seeing the virus change as it continues to spread. So doing those measures to stop that transmission is going to remain critically important, with vaccines being of the utmost importance. Also of importance, I want to mention that many areas that have high or substantial levels of transmission have lower rates of vaccination.
Hmm. So, I think that the urging to get vaccinated has been out there for a little bit, but at the same time, there have been changing guidelines that I know have been personally hard to keep track of. Not only over the course of a year plus, but really recently. Seems like there's been a lot of updates to keep in mind. So, what are the new CDC guidelines that we should be all following to keep each other safe?
Yeah. So it's interesting. I think we've all, and this is where a lot of people are just tired, right? Because the guidelines have changed so often, and it's because it is a novel or a new virus. So as new information is coming out, we will continue to see changes. So it is important to stay up to date on those guidelines. But the current guidelines, if unvaccinated, you must continue to wear a mask to protect yourself and those around you and utilize those other mitigation strategies that were recommended from the start. And then all vaccinated people should wear masks indoors in areas of high or substantial levels of transmission, which I looked at one of the maps on the CDC website, and it really still makes up a predominant area of the United States. And then also keep up with those other mitigation strategies as well, even if you are vaccinated. You should also continue to wear a mask where required by laws, rules, regulations, or local guidance. So some employers may still have those mask mandates, and they may have lifted them. I wouldn't be surprised to start seeing those be put back into place. So just for people to be aware of that. Looking at the CDC website for guidance is going to be crucial as well, just to keep up to date on everything.
Sure. And, obviously we think about employment a lot here at Medics. So all these CDC guidelines trickle back down into the way we work, right? So what can businesses do to keep employees safe as the pandemic continues on in the coming months?
Yeah. So as always, make thoughtful decisions to protect your health and the health of the community and your workforce. This is not over, unfortunately. We saw that glimmer of optimism. But as we start to see vaccination rates continue to go up, I do think things will start looking better. But it does seem right now the greatest risk at this time is to those that are unvaccinated. So employers should continue with their established workplace control programs and mitigation strategies. They may need to adjust those, change those, obviously, due to, again, the changing guidance. So some specific ways that employers can help to mitigate risk would be to encourage vaccines, perform periodic testing, and maintaining good infection control policies that were previously established. So some of these may include daily health screenings, hand washing, social distancing when possible, and masking. And also bringing in professionals such as an occupational health nurse or somebody well-versed in infection to help to manage their infection control plan. That's going to be really, really important. Also, encourage your employees to talk to their personal providers about obtaining the vaccine. I've seen a lot of employers do some really cool things about, just kind of urging people to get the vaccination. Like, it's okay to leave work or whatever. I can't speak to each individual business. That would be, of course, according to the workplace, but definitely try to encourage people if they work crazy hours, try to encourage them to get the vaccine. And then the World Health Organization states that ways to push back against this current surge we're seeing with the Delta variant are public health and social measures. So the same things we mentioned, but other things such as early case detection, keeping up with that isolation, surveillance, testing, clinical care or hospital care, and then things as the mitigation strategies that we've already talked about. So masking, physical distance, ventilation, and then other specific mitigation strategies specific to your workforce.
Well, thank you. I think that's all great advice and actionable items for employers to take, as well as employees, as we all are trying to figure this out together as a workforce and really as a society. I mean, this is a learning experience for everyone, and clearly the situation continues to change and evolve. So we're all figuring this out together. And I'll have to say, I appreciate having you here, Dr. Spain, to sort of walk us through all of this. I wish it was under better circumstances and we didn't have to be talking about a pandemic right now. But if we have to, it's good to have experts on our side to really bring us the latest information and sort of translate it for use in our everyday life. So thank you again for joining us and sharing a little bit of your insights.
Yeah, thanks, Andy. It was great to see you again.